Stomachache, malaria, sex problems. I can help you. I'm the best doctor in town.
Traditional healer Sekou Cissé projects confidence. He has his work cut out for him in the small Malian border village of Kourémalé. He tells the local butcher this concoction can cure his stomachache in 5 hours. He charges the equivalent of €2 for his cures, a day's wages for many people here. We wanted to know if he had heard about the Ebola epidemic in neighboring Guinea.
Yes, but I haven't met anyone yet who has Ebola. I believe in my medicine, and I'm convinced I could help.
But the butcher with a stomachache says he'd rather not depend on the traditional healer if he had Ebola. The state health clinic is a short way down the road. Its director, Dr. Drissa Berthet, is very busy. This is one of his easier tasks, convincing a small boy to let him take his temperature. During peak malaria season, between July and November, children are examined once a month and given free preventive medications. The doctors are able to deal with malaria, and it's not contagious. But there's no medication to prevent Ebola, and Dr. Berthet doesn't like to imagine what would happen if Kourémalé suddenly had to fight the epidemic.
We're very frightened that Ebola will reach here, but what can we do? Today, fortunately, I've only seen children from Mali. I haven't seen any mothers with children from Guinea here. That reassures me a little.
Aïssata Koulibaly has brought her 2 youngest children for malaria prophylaxis. 4-year-old Fanta bravely swallows the bitter syrup. Everyone here has heard about Ebola, and Aïssata knows, thanks to Dr. Berthet, how to protect herself from the disease.
To avoid Ebola, we have to wash our hands regularly, not touch any dirty objects, avoid eating game, and not go to burials. We'll keep to that.
Aïssata and her husband Nidji earn a living from trade with the neighboring country Guinea, which has been hard hit by Ebola. They have a prosperous village shop near the border. They sell peanuts and soap, sugar, rice, and gasoline. Nidji usually buys most of his products cheaply in Guinea. But since Ebola broke out there, things have changed.
This has almost ruined our business. I used to go to Guinea 3 times a month, but now I haven't been there in 2 months. We need help. Countries like ours can't deal with a crisis like this on our own.
In the early afternoon, it's time for Dr. Berthet's daily visit to the border post. Unlike other West African countries, Mali hasn't yet closed its borders to the affected region. Trade is still brisk. Of course, that constitutes a risk for Mali. Since March, all people entering the country from Guinea are checked as stringently as possible with an infrared thermometer. The doctor says they had to force one woman to have her temperature taken, but everyone else has been cooperative. He says this woman's temperature is about normal, so there's no problem in her case. But what if someone did have the typical symptoms? Fever, vomiting, and diarrhea. The doctor takes us along with him. Not far from Kourémalé, the health ministry has erected an isolation ward, consisting of a few temporary huts. Dr. Berthet says they have room for 4 patients. In April, they had 3 suspected cases, but fortunately, they all tested negative. This is a waiting room in Dr. Lanseni Doumbia's private clinic, one of the most modern health facilities in Kourémalé. His patient comes from Guinea. She's suffering from severe stomach pains. It's the only clinic in the entire border region with an ultrasound device.
My wife has suffered from these pains for 5 years. Nobody back home has been able to help her. Here, for the first time, I have the feeling someone can finally find out what's causing her pain.
The lab workers are able to test for typical diseases, but they can't diagnose Ebola here. Most patients in the private clinic are suffering from malaria. People who go to Dr. Doumbia have to be able to afford it. He charges the equivalent of €3 for an examination. Added to that are the costs of medication, lab work, and ultrasound scans. It's too expensive for many, but his service is the best in the area.
I opened this clinic here because our state system doesn't have enough doctors. If patients in the capital can't afford treatment, they might die. That's why I've initiated this project, to help the people.
In the late afternoon, Dr. Berthet writes his daily report to the health ministry in Bamako. The malaria campaign has been successful, and there's nothing unusual to report from the Ebola checks. He can only hope that's not going to change anytime soon.